All right, dysrhythmia drugs at a glance. So first of all, you have the anticholinergic atropine, which will be used in bradycardia, second degree type 1, and third degree as an assist. So it's a secondary treatment of third degree. Adenosone will be used for SVT and sinus tach. It's an antidysrhythmia. Amiodarone is a potassium blocker. This is used in stable VTach. SVT is the second drug used. Atrial flutter and PVC. Beta blockers are used, and actually beta blockers and calcium channel blockers are both used in sinus tach, PVC, atrial flutter, AFib, and SVT. Beta blockers are also used in a PAC, and anticoagulants are used in AFib and A-flutter. Procedures that are done, so cardiovert, synchronized cardioversion, you use in unstable SVT, unsuccessful beta blockers for AFib, and unstable sinus tach. Defib, so shock right away, you'll use in VFib or unstable VTach, which would be pulseless. Ablation, number one treatment for atrial flutter, also used if an SVT returns. And temporary pacer for second degree heart blocks type 2, second degree heart blocks type 1 with symptoms, or sinus brady, it can be possible. And a permanent pacer is most used in a third degree heart block. Okay, sinus brady is associated with athleticness, sleepiness, carotid massage, Valsalva maneuvers, vagal stimulation, hypothermia, increased intracranial pressure, beta blockers, calcium channel blockers, low thyroid, low glucose, or MI. Symptoms are going to be different, so it might be asymptomatic or pale, cool, weak, dizzy, syncope, change of mental status, or shortness of breath. You should treat those accordingly, so giving oxygen or fluids as needed. However, drugs are going to be atropine to help increase the heart rate. If that doesn't work, you might look at trans-Q pacing with a dopamine or epinephrine IV infusion. And obviously, if you have drugs causing this, you need to hold those. Okay, sinus tach is associated with stress and stimulus, anxiety, fear, pain, hypoxia, hypothermia, hypovolemia, hypoglycemia, or hyperthyroid, anemia, MI, heart failure, drugs such as stimulants, so epinephrine, atropine, caffeine, hydroxyline, and over-the-counter pseudoephedrine. The significance is going to depend on the symptoms, so same thing, treat pain if needed, give oxygen if needed, give antipyretic if needed, and this can reduce the cardiac output, which increases the cardiac oxygen use and can lead to angina or MI. Medically or drug-wise, aside from the underlying cause, so you can do vagal maneuvers. The doctor might do carotid massage or cough. The nurse would not actually do the massage. He might prescribe IV beta blockers or calcium channel blockers, adenosine, and then if they're clinically unstable, you would look at synchronized cardioversion.